Good evening. And let's be in no doubt, the Tory attack on our National Health Service is nothing other than an attempt to privatise the healthcare system. And they might dress up the language and talk about more consultation, patient choice, and pausing to listen. But we all know the truth. It's an attempt to dismantle our health provision, bring in the private sector, and ensure less accountability in our NHS. And there must be something seriously flawed in the Tory proposals, backed up, of course, as usual, by the Lib Dems, when united against them is the Health Select Committee, the BMA, patients, and other independent commentators, and many more. And it baffles me why any government of any colour have to get involved in constant tinkering with the NHS model, a model that served us all well for generation after generation. There's this constant obsession with targets, the use of the private sector, and transferring the power to unaccountable GPs that are trained to be doctors, not accountants. What's more, the two key groups in the NHS, the people that matter most, the patients and the frontline staff, don't want these changes. And I've had countless, and I mean countless, letters, emails, telephone calls from people in Halifax about this issue. And not one of them has said to me that they agree with the government's proposals. What patients want is the best possible treatment, free at the point of use, and with first-class standards of care. They want doctors to be doctors and nurses to be nurses. The last thing they want is commissioning done by the private sector. Yet that is exactly what the Tories are promising to do. Yet they can't come out and be clean and admit it. And what's even more outrageous is the unaccountability of all this. None of this was in the coalition agreement, and yet they plough on. Last week's stop and pause exercise showed not the slightest hint of a U-turn. It was an exercise in trying to sell these proposals which are not wanted, needed or necessary to convince an audience. And I also think we need to ask, who benefits most from these proposals? Certainly not the patients, who get told time and time again what's best for them, but they're never consulted. And it's certainly not the staff, some that are here tonight, and it's not even the GPs who have more power, but will soon delegate that power to someone else. And the only logical place to delegate it is to the private sector. And as we know, there's a lot of money in our health service. And it's shameless that the government allows the markets any influence in the commission of services. The NHS should not have a for sale sign above its head. Just look at how things were running in Calderdale for the last few years. And I'm not saying everything was perfect. I thought the Labour government had too much sway for the private sector involvement. But the local PCT did a quite good job. And there was also an element of accountability in the commissioning of services at a local level. It can always be better, but at least it was there. That's all gone away, swept away on a tide of ideology that is typical of the Tories, but lazy and opportunist of the Lib Dems to be supporting it. So what can be done? Well, the broad church opposing these changes is growing by the day. And I've heard this might be the Tories' next poll tax. We need to mobilise a united front against these Tory plans at a local level. We need to remind people how proud we are of our NHS, the people who work in it, and the focus of the government and the health department should be doing everything they can to concentrate on patient care, not the profit margins of the private sector. The health service was founded to put patients' needs first, to ensure the best possible health care is provided. And thanks to such dedicated staff and hard working, in the profession, we still have that. It's time for the government to realise that all people want is investment in the service, in the care and the people who work in it. The Tories cannot be trusted to run our health service, and the almost unanimous vote of no confidence in Lansley last week showed that. But if we mobilise, campaign and shout loud enough, these pathetic plans can be stopped in their tracks, and that could be the beginning of the end of this rotten government. Many thanks.